World Health Organization Country Representative Dr. Walter Kazadi joins us now on the program from Abuja via Zoom. We'd like to thank you for joining us on the program. And I'd like to begin with the comments from the South African president on what he described as hoarding of vaccine. Would you call it that? And perhaps the question also could be, do you see equity in vaccine distribution across the country, the world?
Thank you for having me on this program, and thank you for your question. What I would like to say, and as you know, from the start, the WHO was clear about the need to ensure that all those need the vaccine have access to vaccine. WHO has insisted on equity and the need for equitable distribution of vaccine as soon as they become available and endorsed to the whole world. So, and we were part of the COVAX facility, which was established as a mechanism to that, trying to secure vaccine for both self-financing countries and also low and middle income countries. So we were anticipated to have a certain number of doses through that facility. Unfortunately, and like you said it, we are seeing some other development where the COVAX facility is kind of suffering some setback due to some countries, the self-financing countries, paying upfront for large quantities of those vaccine, leaving those non-financing countries, non-self-financing, with no choice but to wait.
But Dr. Kasadi, should Nigeria and Africa be worried about the supply fears? We know that, the EU is warning that producers must really deliver. And Nigeria is also expecting a batch as well, we understand, the end of January or in February. Should we also be worried?
Well, you know, it's anticipated that this year, the vaccine, the number of those that could be made available through different mechanisms is 19 billion doses of vaccine for this year alone. And for now, the COVAX mechanism is secure just about 2 billion, a little bit more than 2 billion for this year. And that has to be distributed to many other countries, among many other countries, including Nigeria. It's anticipated that the vaccine will be made available progressively because right now there are very few that reach the advanced stage of the vaccine development. There's only one, as we speak, that has been approved under emergency use list by WHO, and there are others that are coming to enrich the portfolio quite soon. So in the coming days, weeks or months, so we should see a better prospect for vaccine availability based on the rate of submission of the data to the WHO. And that in itself could also help ease some of the concern some countries are having, and Nigeria is one of them, of course.
I'd like to get your thoughts on the new B117 variant and its implications. The Presidential Task Force talked about it being identified here in Nigeria, and also seeing that we are in the community stages and we also have insufficient testing that's ongoing. What's your take about its implications to how we're fighting the second wave here?
Yes, you know, as you know, the RNA vaccine, they mutate all the time. And one of the mutants that emerged was the B117 in the UK and in South Africa with different type of mutation. As you said, the Presidential Task Force announced that that mutation has been detected in Nigeria. So what we need to do is to enhance surveillance, genomic surveillance and sequencing so that we know which strain is really circulating in the country. In the country where the B117 first emerged, now it's accounting for more of the positive cases being detected. So in Nigeria, we don't know yet what is, it's an explanation of the second wave we are seeing, although in the country where it has been documented, it was incriminated. So we need to do more research, and CDC working with the other research institutions to do more sequencing so that we can understand. But nevertheless, whether the B117 or another strain, the non-pharmaceutical measures, intervention still work. So we need to ensure that everybody continue to adhere to them. We continue to wear face masks in public. We practice social distancing, washing our hands or using hand sanitizer, coughing in elbow and other measures, avoiding overcrowded, confined environment, and many other measures. So we still have a window opportunity to control this surge. But while doing that, it's important to understand better where this surge is coming from. Of course, the explanation are multifactorial.
But if we comply with all of that, if we look at the compliance safety guidelines, do you think that if they're reasonably adhered to, and looking at the trajectory of the virus, and this, when can we say that the second wave will be over?
Well, that's the NCDC to respond, I'm assuming. But what I can say, if we apply those measures with the necessary enforcement, we should see the impact. I mean, they've been tested. It's possible that we could reverse the trend we are seeing now. But of course, we need to increase surveillance. We need to continue to find cases, to test more so that we could isolate those that are infected and protect others from further infection. So for us to know that we've reached the peak, we'll continue to observe the number of cases. We are seeing new cases we are seeing every day. As you know, the community transmission has been established. We need more effort to curtail it. And for that, adherence to non-pharmaceutical intervention is key for all of us.
We appreciate your time on the program. Dr. Walter Kasadi, World Health Organization country representative. Thank you for joining us on the program.
You're welcome. Thank you.